Hey, this is Dr. Marshall Green at theaestheticface.com. You're up close and personal with me today because we're talking about the eyes. So I got you really zoomed in here. We're going to try and point some stuff out of my face as we talk about eyes. So eyes are one of the most frequent surgeries we do in cosmetic surgery. It's probably the most common cosmetic surgery performed day in and day out around the world, and that surgery is blepharoplasty. Today I'm going to focus only on the upper eyelid and treatment of the upper eyelid. So when patients come into me with eyelid concerns, usually one of two reasons is one, they feel like they can't read anymore, their skin's hanging over their eyes, they're always looking tired, they always feel like they're trying to hold their eyes open, or one, everyone always asks them why they're looking tired, and they can't figure it out, it's just always in their eyes. So focus in today once again on the upper eyelid. So when patients come into me with that upper eyelid concern, there's really two factors that are going on. In most patients, there's the isolated, redundant, or excess lax upper eyelid skin. Okay, so I have a little bit of extra eyelid skin I'm going to try and pinch for you. This extra skin right here. So, even at my age, I have extra eyelid skin. I could probably have a blepharoplasty if I wanted to take away some of this extra eyelid skin. When that happens, that can be simply removed. In my office, I'll typically use a laser to do that, a laser or radiofrequency to take that away, pretty much a bloodless procedure, and then address a little bit of the underlying muscle if it needs to be tightened up, and also the underlying fat bags in the upper eyelid. When patients have really baggy upper eyelids, sometimes we have to remove fat from that area as well. That's really a truly isolated blepharoplasty, if you've heard that term before, upper eyelid tuck, another thing you might hear. So I said there was two things we talk about in eyelid surgery, and that's because there's a very important second component, and that's the position of the brow, okay? So when you look at me, look at my brow, I have fairly low brows for a male. A male's brow is supposed to be at the bony rim of the orbit. So if you touch your face and you feel the bony rim of your eye socket, for a man, that's where his eyebrow is typically supposed to be. Mine are at or a little bit below that, which kind of contribute a little bit to my extra upper eyelid skin. Now the female brows actually supposed to start at or around that bony margin, but then kind of gracefully or elegantly arch upward, outward, and then apex laterally, maybe even drop back down in some patients and be a centimeter out above the orbital rim laterally. Okay, it's a very elegant, very feminine look. And so as we age, though, gravity does win, and those brows will sink down over time. So when my patients come in to talk about upper eyelids, what I'll typically frequently point out to the patient is that, hey, your eyes, it's not just your eyelids, you actually have ptosis of your brow. And what that means is that brow has settled down over time. So you see my brows are really heavy here. And then when I pull them up, you can see how that opens up my eyes. So heavy brows, and then open up my eyes so they don't look as heavy and baggy anymore, okay? All right, so all that being said, where does that leave you, the patient? So if you're watching this and considering eyelid surgery and or brow surgery, I would tell you this. I'll tell you what I do with all the patients I bring in my office. More the women than the men. Occasionally I have a male that needs a brow lift in addition to eyelids. A lot of my female patients could benefit from a brow lift in addition to eyelids, but not everyone likes the appeal or the look of the brow lift. So I'll typically take my patients, sit them in the chair in the examination room, and slightly elevate the brows up into in a lifted position that would simulate what would happen after surgery. And I find very readily patients either like this look or they don't. They may feel surprised, they may feel like their brows don't look appealing, and some patients just really do like that look. So that's how I base my examination of, are you a brow lift candidate or not? Simple, really easy in the consultation room to figure that out. So I'll tell you this, if you're looking for eyelid surgery and you've either got a consultation, if you're going to consultation, if your surgeon hasn't talked to you about your brow position, I would encourage you, one, either ask him about it, or two, second consultation, because once you've had an aggressive blepharoplasty and you have that upper eyelid skin removed, sometimes you cannot go back and have a brow lift performed because so much skin has been taken away. So early is the time to have that discussion. Decide if you're interested or not in a brow lift in combination with an eyelid surgery, and then go for it, one way or the other. So, we talked about a lot of different things. Come to the website, theaestheticface.com. We have some information about eyelid surgery, about brow lifts, different techniques for those procedures, one or two cases on the website. got a large gallery of patient photos in the office, so come schedule a consultation with us. Happy to leaf through those with you. I will talk about lower eyelids in a separate video. It's just too much to cover here today, but frequently those are procedures I do at the same time and rejuvenating the upper third of the face, the brow, the upper and lower eyelids. So thanks for your time. Dr. Marshall Green, theaestheticface.com. Come on the website, check us out. Have a great one.